proposal is a mixed bag. I think there's some aspects of it which we would welcome, including the increased clinical involvement in determining priorities for the health service. There are some areas of it which give us great concern: increased marketisation, increased commercial involvement in the health service, and really a threat to the NHS itself. But the real devil will be in the detail, and we're still waiting for much of that.
Well, it's an exciting time, not only for the NHS and for GPs that will be directly affected, but also, of course, for local government, because what we saw in the white paper was the proposals to set up health and wellbeing boards locally, and that's something that we're very strong on.
The proposals from the government, I think someone described them the other day as fantastically brave, and I think that's a sort of code for yes minister, which means that actually there will be a lot of risk involved in them. I think to completely change the system at a time of financial shortage is indeed a very brave thing to do. It's not to say they're not going to work, but I'd be surprised if they all work at the same time.
I think the important thing is that we really try and learn from the experience of local government. As you've shown what can be done in using the mixed economy of care, you've got a much better budgeting and financial management system, and you also cooperate more with marketing experts to find out what your customers want. I say to local government, come in there and help this health service move into the modern world.
Well, affordable, that's the $64,000 question.
I think the three aspects. One is making sure that we can get the same or better outcomes, health outcomes, for the amount of money we put in. One is making sure that we have a real understanding of what health need is at a population level. So what is it that we should be directing our healthcare resources at? And the third way, and I would say this being a public health physician, is that we need to tackle the long-term demand for healthcare, and the way to do that is by improving the health of the population.
We hear the whole time about shortages, the need for more funds. What we've got to hear much more about is people doing more with less.
The key message that I'd want to leave with people, that if we can make that work locally by joining up budgets across different sectors, then we're far more likely to get not only better services, but the most effective and productive use of public money.
I think there needs to be a change in the nature of the business model of health services in developed countries. I think we need to expect a great deal more of patients and of the public in looking after themselves, and I think that's what they want to do.
I don't think there could be anybody there tonight who is not desperately worried about the reckless nature of this untried experiment. But at the same time, we are also committed to the public health in the widest sense, which means the provision of the best possible health care, as well as preventing people getting things that they shouldn't be developing anyhow in the first place. We're also committed, we want to be positive, and we want somehow to make it work.
I felt it was useful to come and find out what's happening, what people's view is, what the changes are, because we're all feeling our way here. None of us really know what's going to happen.
I suppose with my BMA hat on, I think one of the big issues which wasn't covered tonight, but probably shouldn't have, tonight wasn't the night to cover it, is going to be sort of the contracts issue with doctors coming to local government. How is that going to work? The relationship between the National Public Health Service and local government, and where public health doctors, which doctors I look after, where they're going to fit in.
I thought it was very good. I thought all the speakers made a very positive and constructive contribution, as I expected. That's why I came. And if you can continue to do that in your debates, you'll be making a major contribution to the future.